The Ministry of Health had submitted 10 random SARS-CoV-2 samples to the Caribbean Public Health Agency CARPHA in January for gene sequencing after technicians at a private laboratory in Guyana said they had observed inconsistency in some samples. CARPHA returned the results in early February, where it was determined that none of the 10 samples were variants of SARS-CoV-2, the virus that causes the disease COVID-19. But with Guyana experiencing a new wave of the virus, which has seen an increase in deaths and new cases, there are concerns raised on whether any mutations of the disease are present in Guyana. Even with the government questioning the Pan American Health Organization PAHO's indication that the P1 variant, which originated in Brazil, is present in the country, Health Minister Dr. Frank Anthony on Thursday did not say what action the government has independently taken in recent times to make its own determination. During his COVID-19 update on Thursday, Dr. Anthony would only reference the 10 samples sent to CARPHA back in January.
The only way you can determine whether there's a variant in any country is that you have to do genetic sequencing. As you know, we would have sent samples to CARPHA sometime early in the year. We had sent 10 samples, and none of those 10 samples we have seen anything that resembles a variant. So the results from CARPHA, they have told us we have what was the variant that was circulating before, nothing of the variants of concern. Those are the only 10 samples that we are aware of that went to a lab for sequencing. Certainly we are trying to work out arrangements to have more sequencing done, but again, these things take time, and we'll continue to pursue.
In March, the Trinidad-based CARPHA had suspended testing for new variants of COVID-19 in the region. CARPHA, which began conducting gene sequencing for the new variants in December 2020, has not announced the restart of gene sequencing. And Guyana was pursuing other arrangements with the Pan American Health Organization PAHO to send more samples for testing of the new variants to the Center for Disease Control (CDC) in the United States. Last week, PAHO's advisor on emerging viral diseases, Dr. Jairo Mendez-Rico, had said that the Brazil P1 variant is here. While Dr. Mendez-Rico illustrated the distribution of the variants in countries in the LAC region on a table, it was shown that the P1 variant, which originated in Brazil. Days later, Dr. Anthony said PAHO's local office in Guyana is yet to respond to the government's query on the claim.
Where PAHO probably got its information, I don't know. And that's what we are seeking to clarify, how they arrived at this conclusion that Guyana has variants circulating. We haven't received that clarification as yet. We have sought that clarification from the local office here, and we still await those clarifications.
The variants of concern that have emerged around the world include those that originated in the United Kingdom, B117, South Africa, B1351, Brazil, P1, and India, B1617. For the newsroom, Kurt Campbell.